Great to have you all joining us today. We're just going to let a whole lot of people in at the waiting rooms. Thanks for those who have come back from many other sessions, and also those of you who are having a first time experience with us for Natural Medicine Week. We are all thrilled to have you join us. I'll just get you all to mute your microphones if that's okay. I can mute them at the moment for you, just so that we can just get all those noisy dogs and kids and things that make a noise during our presentation. That would be absolutely fantastic. And I'll let people come in as they are ready. We'll have people joining us throughout the session. It's a busy time of day, but that is totally a-okay with us. So welcome to this session for Natural Medicine Week. We're talking happy tummies, happy kids, the gut stress connection. Oh, I love, love, love this topic because we're going to talk about how your child's gut health can influence their mood and their stress levels and their overall well-being. And to do that with us, we have Clinical Nutritionist Samantha Bake, who's going to help you explore that link between gut health and children's behaviour. So she's going to go through all of those things, the impacts of stress and mood and focus, the role of diet in calming anxious behaviors, their resilience, nutrition strategies. She is the expert in that area. So I am going to hand over to Samantha, and I'll continue letting people in. So welcome, and over to you, Samantha.
Thanks, Annie. And I see a few familiar faces there, which is lovely. Now let me just share my screen and we can get this started. Okay, well, hi everybody. Lovely to see you all. Let me just move this so that I can actually see my presentation. Okay, happy tummy, happy kids. Let's ooh, why is that not doing its thing? There we go. So what I'm going to cover, why gut health matters more than ever for our kids. I'm going to explain some of the technical terms, the jargon. So when you hear it on TikTok or Insta or in the news, you'll know what's happening. I'm going to discuss how stress affects digestion and how that has a flow-on effect, digestion affecting behaviour. There's going to be key signs that your child's tummy could be contributing to their symptoms. Lots of real life examples from my life as well as my patients, and then practical evidence-based strategies so that you can finish this webinar and go home and start applying it straight away. I do just want to add that, this is general health information. It's not medical advice and shouldn't be treated as such. And you should not rely on the information within this webinar as an alternative to speaking to your healthcare provider. And those of you that I did notice that actually already see me as your healthcare provider, you'll probably know some of this already because it is something that I do talk about a lot. Now, you're not alone in this. I'm a parent. I've been there too. And, my youngest, when had a great prep year, it was awesome. She had lots of friends in her class. She loved her teacher. She loved going, so much so that I should have taken this as a warning. The last day of prep, she sobbed for an hour because she wasn't going to have Miss Taylor next year. I thought school holidays would settle it all down. We'd get into grade one and it'd be as easy as it had been during prep. She didn't have a best friend in her grade 1-2 class. It was a composite class. She was one of the younger kids. She didn't gel with her teacher as quickly or as easily as she had with her prep teacher. And the first term wasn't too bad, but come second term, she knew my schedule down to the minute. She knew the day that I finished at lunchtime, and you could guarantee I would be waiting for the train or I would just have got on the train and I would get this phone call from the office and it'd be, hi, she's here in sick bay. She says she's got pains in the tummy, that she feels like she's going to be sick. And I'd be like, okay, I'm on the train. I'll be there as soon as I can. We'd get there, we'd get home, she'd lie on the couch for a while. I'd go through the list of questions. Did you eat your lunch? Have you been drinking water? Did you go to the toilet? Do you need to go to the toilet? No other symptoms. She'd lie down for a little while and then she'd be perfectly fine until it happened again. Now, in hindsight, I should have picked up on it earlier. I looked at, what was she eating for lunch? How often was she going to the toilet? Everything else that was going on. But it was actually, she was really anxious. And so she didn't have the words to explain or to understand that churning, I feel sick in my tummy, wasn't because she was actually going to be sick. It was because she was anxious and nervous about, fitting in with the classroom, and she was taking things on board that the whole class was told they needed to do better and thinking it was she needed to do better. So we did look at what she was eating and making sure she was drinking plenty of water, and worked with the teacher and the wellbeing staff as well. But I have been there. I know what it's like and how frustrating it can be to not know how to help your child. Whoops. So, why does gut health matter for our kids? Recent Australian statistics suggest that 1 in 20 children have ADHD, 1 in 33 are autistic, and post COVID, up to 40% of our kids are experiencing mental health concerns. Now, I'm not sure where all of you are from. I know some are from interstate, but I'm from Melbourne. So we had those 2 years of lockdowns. We absolutely had an increase in mental health concerns. In teenagers, we were seeing anxiety, depression, and an increase in eating disorders. In the younger age groups, you had kids who were struggling to move, that they were the COVID babies, so that it was their first introduction to kinder and things like that, or they kind of missed out on kinder and they were moving straight into school. Now, kids with behavioural conditions also often have a history of poor digestion, chronic constipation, food intolerances, recurrent infections. Now, if you look at that list, there's one thing that they all have in common. They're not random, they're often gut related. So before we get too far further into the presentation, I just wanted to explain some of the technical terms, the jargon. So the microbiome, that's the good, the bad, the ugly, the bacteria, the yeast, the other microbes that are living in our gut. The metabolites are the chemicals that our gut bacteria make. So both our good and our bad gut bacteria, and they send messages to the brain and the body. So they could be inflammatory, they could be beneficial, serotonin. Intestinal permeability is also called leaky gut. So that's where the cells that line our gut, we want them to be nice and tight and sit together like that. But when we get a leaky gut, we get gaps between those cells. And that lets things like metabolites from your gut bacteria or undigested food slip out into the bloodstream. Dysbiosis basically just means an imbalance in our gut bacteria. So that's where our harmful or opportunistic gut bugs outnumber the good guys. Neurotransmitters, there are brain chemicals, things like serotonin, adrenaline, dopamine, and GABA. So they play a role in mood, in sleep, and in behaviour. Now, the last one, the vagus nerve, I need you to remember this one, it's important. So it acts like a two-lane highway and it connects the brain and the gut and helps us manage stress and digestion. And that's going to be something that we talk about more during this presentation. So the gut-brain connection is sometimes also called the gut-brain axis. But basically, it's all about that vagus nerve and that two-way conversation between the gut and the brain. Our immune system's also involved, and those metabolites, those chemicals that our gut bacteria produce, are also important there. Now, 70 to 80% of our immune system resides in the gastrointestinal tract, which makes sense. That's one of the main ways that pathogens can enter our body. Then 80 to 90% of our serotonin, which is our happy, calming neurotransmitter or brain chemical, is produced in the gut as well. So if you've got low levels of serotonin, that's associated with anxiety and depression. And you can see that sort of visually depicted over here in this image. But serotonin is also the building block for melatonin. So melatonin is what helps us fall asleep at night. So if you've got something going on in your gut that's affecting your serotonin production, you can have a flow-on effect to that sleep onset with our kids. Now, in children, anxiety is often expressed physically, and my daughter was the perfect example of that. They don't have the words to describe how they're feeling anxious or nervous. And sometimes it's not even like a bad type of anxiety. It's I'm excited something good's going to happen, but as an adult, you'll recognize that churning kind of not quite queasy, maybe a bit feeling in your stomach. We recognize that as, okay, I'm feeling nervous, excited, or okay, I'm feeling nervous, anxious. But kids don't have that life experience to have those terms. What they say is my tummy hurts, or sometimes it's my head hurts. And that's usually the first sign that many parents notice before any other emotional behavioural symptoms happen. So you might get the school refusal, the separation anxiety, you might see changes to their eating. And again, that can be because of those real feelings of, being nervous and anxious. I didn't eat as much breakfast this morning as I normally would because I was feeling a bit anxious about today. Um, and then that has a flow and effect to the toileting and sleeping with our kids as well. You might find they need more reassurance or they're wanting things to be perfect and they're really upset if they're not. But usually, the first sort of sign before you get to that cascade of symptoms will be that my tummy hurts or my head hurts. So, how do kids feel their tummies? The gastrointestinal tract is full of specialized receptors that detect different types of things. And the way I like to explain it to kids is that the receptors are like a doorbell, but they only ring when the right person, or in this case, the right chemical or the right sensation, touches the doorbell. So your stretch receptors, they're activated when your stomach or your intestines fill with food or gas or liquid. So when they feel that stretch, that's the right thing pressing the doorbell and they send that message. Chemical receptors detect acidity, nutrients, and irritants. They don't care if it's stretching, it's only if they get that acidity that the doorbell's going to ring. And the same for pain receptors. They pick up if there's something wrong or inflamed, and we've got temperature and pressure receptors as well that monitor the environment in our gut. But each one will only ring that doorbell if it's the right chemical or sensation. So some kids and some adults, they feel pain or discomfort from normal gut sensations. So that's called visceral hypersensitivity. So sorry, there's no. Can somebody turn off their mute themselves? Thanks. So yeah, their brain and their nervous system are more sensitive to normal digestive movements of like gas, and they're reading it as pain or distress. So that's why, some kids will be complaining about tummy aches and there's no other sign of illness. It's because their receptors, their doorbells, are more sensitive. So if you or me, with that stretch or, change in nutrients or acidity, the doorbell's going to ring once. For them, it's like somebody's leaning on the doorbell. It's going ding, 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 ding. Have you noticed me yet? So the sensation's very real and it's very uncomfortable for them. And it's more likely to happen if they're stressed or anxious or if they're recovering from an illness as already. Now, this is another example from my life. Same child. She was about 10 at the time. And, put up your hand if, as a parent, you've been there, everything's fine, not a problem until it's time to go to bed. So frustrating on so many levels. Sometimes it's like, oh, what are they anxious about? What's happening tomorrow? What's the problem? Is it just that they don't want to go to bed? In this instance, she'd be fine. We'd do the homework, they'd be cleaning their teeth, not a problem. She'd be in bed 5 or 10 minutes, and then all of a sudden she'd be back out. And it's like, my tummy hurts and it's really sore and I can't lie on my side. So it'd be like, okay, go to the toilet, nothing happened, back in bed, tears some nights. We do the wheat bag, we'd work out what's going on. I'd kind of, again, this is an instant where as a parent, you're kind of ticking off all the boxes, and I had to take a step back and go, I'm just going to talk to her about the science. I don't know what's triggering this, but there's a normal digestive process that happens about 90 minutes after you eat. So with younger kids, often when they're going to sleep, And it's called the migrating motor complex, but it's basically a wave-like movement that pushes your food and your gut bacteria on to the next stage of digestion. So it is those muscles contracting as they move things on. And so I explained to her that, it's a normal process. It's just moving everything on. I think you've got visceral hypersensitivity. I think you're a super feeler and that you can feel those processes happening in your gut. But once it's moved on to the next section of digestion, you're not going to feel it anymore and it'll be okay. Now, for her, that took some of the fear and the worry that, oh my God, what's this? Is it going to keep going? Am I going to be sick? What's happening? And we started to be able to get back into our normal bedtime routines. We worked out that if she lay on her back, it was more noticeable. If she was on one side, it was better. Wheat bags did help. It was funny when I was putting this presentation together, she happened to come in and was reading this slide over my shoulder and she looked at it and went, oh, the MMC, that still happens. And I'm like, well, you don't complain about it anymore. She said, well, I'm not going to bed when it happens anymore. I'm doing homework. But besides which, I know it's going to stop. It's normal. So that can help take the stress out as well. Now, meet the microbiome, sometimes called the second brain. It's made up of trillions of microbes. They used to think it was about 100 trillion. Now they think it's about 39 trillion. Still a lot. It's involved in regulating our digestion and our metabolism. It's made up of bacteria, viruses, fungi, and protozoa. But if that's all in balance, then we tend to have calmer moods, stronger immune function, and better focus. And one of the really cool things is that through diet over time, you can help shift it and make it more diverse. So factors that can impact the gut. Well, where you're born. I had one patient who was born in Russia, and when we did a stool test, there was lots of different species that I wasn't used to seeing come up in my stool tests with people that have been born in Australia. How you're born, whether it's a C-section or whether it's a vaginal birth, has an impact on your gut microbiome. If you're bottle fed versus breastfed, with breastfeeding, you do pick up bacteria off the skin as you're going. Reflux medication can play a big role. Uh, you know, it saves many parents from going insane when you've got a baby with reflux. It is important. But when you're using it longer term, the way it works is it changes the pH in the stomach. So that can have an impact on the breakdown of food when they get to solid food. And it also means that some of the bacteria that would normally be knocked out from the acid stomach environment can sometimes slip through and make it into your intestines. Antibiotic use, especially before the age of 3, or if you've had a lot of antibiotics, can play a role. And again, antibiotics are life-saving. They have a place, but taking probiotics when you're using antibiotics can help mitigate the fallout that you get on your microbiome. And then diet, as I said, they've done studies that looks at the microbiomes of people from Central Africa versus Western countries. They've looked at the microbiomes of people who have a more carnivore diet versus vegetarian. The good news is that you can shift and increase the diversity of your microbiome through diet. It's just a longer, slower process. Now, imbalance or dysbiosis. When that happens, sometimes it's that you've lost your beneficial bacteria. That could be because of antibiotics or you've had gastro. It could be because you've had harmful bacteria basically come in and take over. It's liked the environment and it's pushed others out, or that you've got less diverse bacteria in your gut, which is often what I see. So it's about trying to find that balance. Now, symptoms of gastrointestinal imbalance in kids. Reflux, constipation, diarrhea makes sense. Sometimes it's food cravings, especially sugar. There are families of bacteria and of yeast whose favourite food is white bread, white rice, white potato. So you'll get the kids craving those things because the gut bacteria are craving them. It can affect their sleep and their fatigue, eczema and skin rashes. If you've got a leaky gut and those bigger particles of food are escaping out into the bloodstream, then that can be a contributing factor for eczema, especially. If you're seeing their behaviour change after meals, sometimes it is a food intolerance issue. Sometimes it can be the additives or preservatives or colours in the food, but it can also be the chemicals produced by your gut bacteria. Anxiety, emotional reactivity, mood swings, and it's also been linked to ADHD, autism, and anxiety. There's a host of studies where they've compared kids with ADHD and autism, sometimes with their twins or with family members, other times versus what they call the control group, and it's shown distinct differences. There's often less bifidobacteria, your beneficial bacteria, and sometimes there's more pathogenic bacteria as well. Now, the gut stress spiral. Stress decreases our digestive enzymes. So, digestive enzymes are important for helping us break up our food. Stress also can slow down our gut motility. So, gut motility is how fast your food moves through the digestive tract. If it's really slow moving through the digestive tract, you're more likely to have constipation. If it's really fast, you're more likely to have diarrhea. So those lower digestive enzymes can lead to bloating, to gas, to discomfort after meals. You can have an impact on your metabolism or absorption of nutrients, because especially things like iron and zinc, because the foods aren't being broken down as well, or maybe they're moving through too fast or too slow. Uh, Undigested food particles can feed our harmful bacteria. They can also escape into the bloodstream. And slow motility can lead to constipation. Now, the cells that line your gastrointestinal tract are one cell thick. And if you think about it, you've got this really thin lining of your gastrointestinal tract, and you've got constipation. So your bowel motion is being slowly dragged or pushed through your digestive tract, and it's almost like gravel rash. So, we've probably all had gravel rash at some stage of our lives, and it hurts. It's inflamed. It's a bit raw. So the cells that line your gut, again, they're going to be inflamed and they're going to open. That lets those chemicals back out into your bloodstream. So everybody's normal digestive processes take different amounts of time. The average is you want to be doing 1 poo a day. If it's in there for longer with constipation, then you're going to be reabsorbing those chemicals. And that's when you're more likely to see those behavioral changes. You've got that inflammation happening, you're going to get irritability, maybe aggression, anxiety, and that then has that flow on effect to impact the release of stress-related chemicals from the brain. So you're going to get adrenaline, you're going to get cortisol. That's going to have that flow-on effect to gut dysfunction again, impacting your digestive processes. So it can become a bit of a vicious cycle. So what causes gastrointestinal stress in kids? Again, it's those infections, your bacteria, your viruses, your parasites. It can be antibiotic use. It can be poor diet. So like those ultra processed foods, your snacks where you look at it and go, hey, apparently there's potato in there, but you look nothing like a potato chip. Your sugar, your additives. So things like emulsifiers, preservatives, artificial sweeteners, your colours can all have an impact. Environmental toxins. So that can be things like heavy metals, pesticides, herbicides, or mold. So you do get aflatoxins, byproduct of mold in some foods. Food intolerances, often they're undiagnosed. If there's emotional stress, if they're in an environment where they're anxious or stressed, then those stress chemicals have that flow-on effect. Constipation, like we've already discussed, and then intestinal worms. Now, I think sometimes parents aren't aware or aren't thinking about intestinal worms. I know when I was growing up, we all just got treated for worms a couple of times a year. And then I think it fell out of favour. And it's not just teeth grinding and itchy bottoms. Like those are common and that probably would lead you to think about doing a worm treatment. But some kids don't have those symptoms at all. Instead, what they have is sleep issues, especially around the full moon, because intestinal worms seem to like the full moon. They could have increased irritability or, really emotional outbursts, hyperactivity or attention issues, food cravings, that's sugar and carbs again. It could be nutrient deficiencies, especially iron, because they snack on that first before we get to absorb it. And I have seen treating kids for intestinal worms make noticeable improvements to mood, concentration, and overall well-being. So that's something to consider if you haven't done a worm treatment for a long time. Now, this is another case study from one of my patients this time. He was about 7 when he first came to see me. He was fussy eater, really limited diet. His main foods were chicken nuggets, McDonald's chips, fruit toast, crackers, and there was a handful of other things. Oppositional defiance, the answer to anything was basically no. He had quite severe intrusive thoughts. So he was very concerned about a family member dying. They weren't particularly old and they weren't sick, but they were the oldest one in the house. And so on a daily basis, he was talking about how they'd be next and how they were going to die and what was going to happen when they died. He was also a very angry young man, and he would lash out at home and at school if things weren't going his way. So much so that he was at risk of being expelled from school. And his mum was like, I don't know where we're going to go next if this happens. So because he had such limited foods, it wasn't going to be easy to try and hide anything. So he needed to go for the least amount of taste and the most likely to work. So I chose a probiotic that was one that had some gut support and some immune support. It was a vanilla flavour and the texture of icing sugar. So quite easy to get kids to take that. The prebiotic, the fibre powder, was heat stable, would dissolve completely, tasteless. So could put it in a drink bottle and shouldn't know it was there. And then we had a multi-mineral, multivitamin powder that was peach berry flavour. So no real way to hide that. The prebiotic went in his drink bottle, that was okay. The probiotic and the multivitamin mineral powder went in a fruit juice, and it involved a cash incentive to get him to take it. It was basically bribery and corruption. And I know I've been there with my kids before. So she used cash and he would take it. So probably one of the nicest days I'd had in clinic was when I got an email from her going, we've had 40 days and he hasn't hit anybody at home or at school. The intrusive thoughts were completely gone. And that was about 2 months into treatment with me. That was the beginning of the year. By the end of the year, he actually got student of the term for his exemplary behaviour in class and engagement with his learning, which mum was over the moon. She was like, oh my God, he's a different child. Now, we still hadn't managed to increase the variety of what he was eating that much. We had been able to do a little bit more work on his gut microbiome, but just the difference in getting those extra nutrients in there. He wasn't constipated anymore, thanks to the probiotics and the prebiotics. So that made a huge difference to the family's everyday life. Now, I apologise in advance. This children's Bristol stool chart might put you off some foods, but it is a great way to explain to our kids what the perfect poo or what a normal poo should look like. So number 4 is what we want it to be. So like a sausage or a banana, it should be smooth, no cracks. Mid-brown sort of colour. It shouldn't hurt. You shouldn't need to strain. No blood, no mucus, no undigested food, unless you've been eating corn, because none of us can digest that properly. And then, when you've done, you should feel like you've got it all out and that it doesn't take too much toilet paper to clean it up. It's important to know what your normal is so that if it changes, you know that that's something that should be looked at, whether it's I'm not drinking enough water, what are we eating, are you coming down with something? So I did used to have this Bristol stool chart on the back of our toilet door for a couple of years when the kids were little, so that they knew what they should be looking for or at if there was any problems. And, they did used to come to the dinner table and go, Mum, I just did a poo. And my husband would be there like, no, no, we're not talking about this now. But it does help you to know what's going on. And you can just Google children's Bristol stool chart, and there's plenty of downloadable ones on the internet. Now, probiotics and prebiotics. Prebiotics are found naturally in lots of plants, bananas, your berries, apples, your legumes, your oats. Asparagus is especially good, but garlic and onions. They are different from probiotics. Prebiotics feed your probiotics. They feed your gut bacteria. They enhance the environment so that it doesn't suit bad bacteria as much. They help support immune system in the gut. They protect the gut wall and support digestive processes. Probiotics are when we add in basically beneficial gut bacteria. So you can get them as a supplement or you can get them in foods. So I know Bega has one brand of yogurt that has therapeutic doses. Valia is another brand of yogurt that has therapeutic doses of gut bacteria. Or you can get it in food. So your kefir, your sauerkraut, your kimchi, your kombucha, miso, etc. Probiotics, we used to think you took them and they repopulated the gut. Now we know they live for different lengths of time. So some probiotics will live for 24 hours, some will live for a few weeks in your gut. But what they do is help shift the environment so that it's one that suits your beneficial bacteria. And that's how they promote the growth or repopulation of beneficial bacteria. Now, I do recommend if you're starting a prebiotic powder or you're bringing in a lot of probiotic foods to start off slowly and gently because you are shifting the gut microbiome. And if you go in with lots of prebiotics, that's going to be somebody's favorite food. So they'll hoe into it and they'll start fermenting. Or if you bring in a lot of like sauerkraut, for example, I'd say start off with a teaspoon. Don't start off with, several tablespoons, because again, you're introducing something new to your gut and you want it to be able to adjust. So you increase slowly over time. Now, the next few slides are a little bit sciencey, so I apologize in advance, but there is a reason for it. So, based on Latin is how they worked out how animals, plants, probiotics are all named. So you've got your genus, your species, down to your strain. So your genus is like your family name. So for me, it would be Bake. The species is like my first name, Samantha, and then strain is where I'm from. So Samantha Bake from Melbourne. Here we've got Lactobacillus reuteri, DSM 17993. There's other strains of Lactobacillus reuteri. Now, why does probiotic strain matter so much? Closely related subspecies can have very, very different characteristics. So if you picture a dingo versus a chihuahua, so dingo is Canis lupus dingo, chihuahua is Canis lupus familiaris. I don't know about you, but I do not want a dingo curled up on my couch. I would much rather have a chihuahua. They're very different subspecies, even though they're both Canis lupus. And the same is true for gut bacteria. So Escherichia coli, or E. coli nisle, 1917 is beneficial. It helps support a healthy gut. It helps prevent inflammation in the gut. Escherichia or E. coli 0157H7 is actually a foodborne pathogen. It can cause severe diarrhea and impact your kidney health. So you absolutely do not want to get these two mixed up. Now, this is the really sciencey bit, but it's only one slide. So there was a study where they gave Lactobacillus rhamnosus GG for the first 6 months of life to a group of about 75 kids. And then they followed those kids through to age 13 and looked at how many had been diagnosed with autism or ADHD. So in the group that got the probiotics, there was no diagnoses. In the group that didn't get the probiotics, 17.1% of children were diagnosed with ADHD or ASD. Now, this doesn't mean that Lactobacillus rhamnosus GG is a cure-all, but it's one of those studies where they've looked at strains of probiotics that help support mood and cognitive function. Now, Lactobacillus rhamnosus is a really common family of probiotics. There's Lactobacillus rhamnosus HN001. That's been found to enhance immune function, especially in children. There's Lactobacillus rhamnosus GR1. That's often found in products designed to help support vaginal health in women. And then Lactobacillus rhamnosus roselle 11. That's found in formulations that are trying to help prevent antibiotic-associated diarrhea or provide relief from things like irritable bowel syndrome. So they're all great probiotics at doing their job, but if you want them to support mood and cognitive function, you're not going to use Lactobacillus rhamnosus GR1. So when you're looking at probiotics in the pharmacy, especially if you're looking at probiotics online, you want to make sure that when they list off their ingredients, that they're listing off Lactobacillus rhamnosus GG or Lactobacillus rhamnosus HN001 for all those different species, because it means that they've looked at the research and they've gone with a strain of probiotics that has shown to have benefits or effects in whatever the probiotic formulation is for. If you've got one that just says Lactobacillus rhamnosus, you don't know if you've got GG or if you've got HN01 or Roselle 11. You don't know whether it's actually going to be the right thing for the purpose that you're buying it for. All right, that was the science done. So what can we do to support our kids' gut-brain connection? We can look at identifying triggers and stresses. We can support our gut and our brain function. We can build resilience through nutrition and lifestyle, consider testing, and there's different testing that might be relevant for different kids, and then restore our microbial balance as or if needed. Now, this busy little diagram is to give you a bit of an idea of how many different things can be at play with behavioural issues. And I could have drawn more lines, but it was getting difficult to kind of make it work. But you can kind of see picky eating can be linked to nutrient deficiencies, low iron, that can link to parasites, diarrhea can lead to nutrient deficiencies, but parasites could also cause constipation, which could go around and trigger inflammation. Allergies and dehydration can also trigger constipation. There might be a genetic component. You can have pro-inflammatory genes, you can have genes that predispose you to food intolerances. There's lots going on, and as a parent, it's really difficult because you're in the middle of it day to day to work out, okay, what's at role here, or is there multiple things contributing? So nutrients to support the gut. Now, a leaky gut, as we've already talked about, can play a big role in what's going on. So having protein in the diet, because protein breaks down into amino acids, and that's the building blocks for, our everything in our body, our muscles, our repair, the lining of our gut. It's important for digestive enzymes. It's an ingredient in our neurotransmitters. So making sure that they've got a spread of protein across the day. And it doesn't need to be heaps of protein. You want about 1 gram per kilogram that they weigh. And to give you an idea of the protein content of food, 1 egg is about 5 to 6 grams. Adult sized portion of steak, so about the size of the palm of our hand, that's 26 to 28 grams of protein. So they don't need a huge amount, but spread across the day. That helps with that repair of the leaky gut. They also need vitamin A, vitamin D, and zinc. They're all important for immune function in the gut. And vitamin A is also really important for the health of the mucous membranes that line our gastrointestinal tract. Now, removing gluten, I guess it's one of those things that you go and see a naturopath or a nutritionist and people joke that you'll be told to stop gluten. I don't tell everybody to stop gluten, but there are instances when it is really relevant. So if you're a human and you eat gluten, your body produces a protein called zonulin. And what zonulin does is causes those cells that line our gut to open. Scientists are still arguing as to how long that opening stays open for. But we know if you've got food intolerances, inflammation, or a dysbiosis in the gut, those gaps will stay open for longer. So when we're trying to heal and repair the gut, I do generally recommend removing gluten or going as low gluten as you can. Then we want to support our microbiome. So probiotics, prebiotics are fermented foods. If we want to improve digestion, then you can still use food as medicine. Pineapple, kiwi fruit, and pawpaw or papaya all contain natural digestive enzymes. So you can add that to their lunch boxes, add it to salads, have it as a part of your dessert, and that will help them break down their food and get all their nutrients. So that can be useful with constipation as well. Bitter foods is a bit harder to get kids to eat, but rocket and radicchio, those bitter compounds in that help stimulate bile production, and bile's what helps break down the fats that we're eating. You can increase your stomach acid with lemon juice or apple cider vinegar. And again, not necessarily something that's easy to get kids to take, but you can use it in salad dressings and cooking. You can get apple cider vinegar gummies or make them yourself as well. And then herbs. So ginger, which you can use in cooking or you can have as a tea, for example, that helps move everything on. It's called a prokinetic. So it's about helping everything move on to that next stage of digestion. Chamomile as a tea is calming on the digestive tract and on the mind. So that can be quite useful going to bed. Fennel, you can chew on fennel seeds, which will help with your digestive processes or included in your cooking. And then peppermint again, that can help settle a stomach. And, tea is really easy for that too. Nutrients to support the brain. So carbohydrates are our brain's favorite food. But if you have easily broken down carbohydrates, you do get that spike. So combining protein or healthy fats with your carbs helps it mean it's more of a hill rather than a big spike and then a crash, which can be sometimes what's at play with mood. But protein and healthy fats can also be used by the brain for energy. From a mineral point of view, zinc, iron, iodine are really important for the brain as well, and vitamins A and D again, and then B6, B12, and folate. So you get zinc and iron through animal products, through your meats and eggs and things like that, iodine from seaweed, seafood, etc. Vitamin A from animal foods or your orange and yellow foods. Vitamin D, of course, from the sun or as a supplement. And then B6, B12, and folate. B12 comes from animal-based foods. B6 and folate you can get from leafy greens and grains. Special nutrients, your omega-3s. So omega-3s are found in seafood, things like your chia seeds, your walnuts, your algal oils. And its core components are converted to DHA and EPA in the body. So EPA is anti-inflammatory. DHA is really important for that brain structure and function. So your brain is growing and developing a lot in the first 8 years of your life. So you want to make sure you've got good levels of DHA for that growth and development. And there's studies that have shown you need EPA as well, and that it's been quite beneficial in terms of ADHD. Choline is another nutrient that we make in our bodies, but you can also get through foods like eggs. Again, it's important for growth and development because it makes up the fatty outer layer of each of our cells. And finally, water. I wasn't quite sure where to put water, but it is a very important nutrient for our digestive tract, but also for our brains. So the brain is made up of a lot of fat and water. And the way I describe it to kids is that we want your brain to look like a nice big juicy grape. If it's like a nice big juicy grape, then it's got everything that it needs to do its job. If it looks more like a sultana, shriveled up, because it doesn't have enough water, then everything's going to be harder. Your thinking process is making your body run. So what we want them to do is drink water across the day so their brain looks like a grape, not a sultana. Now, building resilience through lifestyle. There's been a number of studies that have looked at green space, so basically getting outside and moving in the sunshine, especially in the first half a day. And they found that half an hour of aerobic exercise uh, in the morning carried through in terms of benefit for cognitive function for the rest of that day. Now, if you were able to do aerobic exercise every day or most days, then the cumulative effect carried through on the days when you weren't able to be as active. They then looked at whether you were walking around your neighborhood, walking around the city, or if you were in a park, which had the most benefit. And they found that actually being in a park in green space had a bigger benefit than the other two environments in terms of that cognitive function across the rest of the day. So it's been a bit cold here in Melbourne the last few days, but if you're able to get out earlier in the morning in bright light, then that's going to have benefits for cognitive function and mood in kids and in adults. Now, deep breathing exercises. Deep breathing, where you breathe in for a count of 4, out for a count of 5, where you breathe in, you hold, and then you breathe out, helps flip the stress response. So it stops that cascade of stress chemicals and calms everything down. So with little kids, that can be, how do I teach them to do that? What I recommend is you need to do it when they're not having a meltdown or losing their mind so that it becomes a default thing to do when they need it most. So if everything's calm, you go into bed, put a toy or a pillow on their chest, get them to breathe in and as high as it can go, and then breathe out and see how low it can go. So they learn what that sensation feels like. And then you can teach them as they get older about, counting and doing it any time that you do need that. And then the last thing, quality sleep. So a dark, cool bedroom, screens off for at least an hour before you want them going to sleep, and a consistent routine. Again, insomnia is one thing that's often described as being a component of ADHD, but it's not actually a diagnostic criteria. But if you think about it, if you're really tired, you are more irritable, you are less focused, it is all harder. So again, that bright light in the morning can help reset your circadian rhythm and make it easier to go to sleep at night. Now, functional testing, blood tests you can get through your GP, things like iron, your zinc and copper, your B12, your folate. If you suspect allergies, total IgE can be relevant. But there's been suggestions that iron, for example, low iron is linked to ADHD-like behaviours, so irritability, inattention, and if you've got tics, iron's linked to increased intensity and frequency. So there's some studies that have suggested if general nutrient panels were tested and any nutrient deficiencies were fixed, that for some mild cases of ADHD, they might not actually have been diagnosed if that had been corrected before they did the ADHD assessment. Now, this is the type of testing that I do, functional stool testing. So it looks at measures in your gut where, digestive processes or inflammation play a role. It also looks at the production of your beneficial chemicals by your beneficial bacteria. And then, do you have parasites? Do you have yeast? Is something else going on? The technology has evolved so that now we're able to map 95 to 98% of your microbiome, so we can get good information about diversity as well. Sometimes it's not that you've got something bad in your gut, you just might not have enough of the good guys. I do IgG, food intolerance testing, with some kids. This particular patient, they were reacting to things like yogurt and cakes and chocolate, but also roast dinners. So you can see here, vanilla was off the chart, but dairy wasn't such a big problem. So it was the vanilla in the yogurt, the vanilla in the cake, the vanilla in the chocolate that was triggering things. And with the roast dinner, it ended up being broccoli, which is not something that you would pull out on an elimination diet. But for some kids, that can be really relevant. One thing that I do differently to some other practitioners is I do a lot of functional nutrigenomic testing. That's looking at genes, common gene variations in the population that you can affect through diet, through lifestyle, and through taking the right type of supplement. So, um, for example, the serotonin receptors. If you've got a variation in your serotonin receptor, then that can have an impact on how you perceive stress. You're more likely to find things stressful than somebody who doesn't have that variation. And there's things that we can do to support it, that particular gene variation movement, deep breathing, magnesium and B vitamins can all help support its functions. So, in summary, it's a two-way conversation between our tummy and our brain. And, you'd want to help support that feedback loop so that it's not going into that stress dysfunction spiral. Anxiety is often physically expressed in kids. What we eat can feed our microbiome and can make a massive difference. So can drinking enough water. Um, One take home I want everybody to have is that knowing what your poo looks like is important, your normal poo. Um, the right probiotic for the job, and that seeing a health practitioner can take the guesswork out of it. When we looked at that mind map, all the different things that can contribute to behavioural concerns and stress and anxiety in kids, somebody like me can step back and look at everything, whereas you're in the trenches living it on a day-to-day basis. Um, Now, if you do want any further information or you are interested in seeing me as a practitioner, the QR code there will take you through to my website. And I guess now are there any questions that you would like to ask?
Oh, that was amazing, Samantha. Thank you so much. Wow, so comprehensive, so much information. It was like, wow, I bet all of you have been sitting there writing it down. The great thing is we can actually watch these on replay as well. They'll also be on the Natural Medicine website and also on our YouTube channel. We do have a question from Jane. It said, do you need to get diagnosed with intestinal worms before doing a treatment?
No, because you can do stool tests, and to be honest, in all the years I've been practicing and all the stool tests that I've done, I've only had worms show up twice, and they were in an instance where, like, the mum had said she had seen worms,
Mm,
and because they're not homogenous throughout your digestive tract. So if there's symptoms, especially if you do get the teeth grinding and the itchy bottom, or it's more around that full moon kind of time, then often I do recommend just getting Combantrin from the pharmacy and doing a treatment.
just if in doubt, do it anyway, is what I'm hearing.
Yeah, pretty much.
Yeah.
It won't hurt. It will just I guess, hang on, let me slow down. The important thing to note is that they only kill live worms. So if you only do the treatment once and there's eggs still in their gastrointestinal tract, then 2 weeks' time you'll have the same thing happening again. So you do have to do that repeat treatment in that 10 to 14-day space.
Mm. Thank you. We have another question from Sarah. What do you do when your child has a number of diagnoses, is taking a lot of medications for these, is also taking a lot of vitamins to help with all of this, but still has symptoms you were talking about? We have also done a lot of testing and treatments. Wow, Sarah, first of all, that's you've got a hard lot going on. Over to you, Samantha.
Yeah, look, I do have people come and see me that have done a lot of work with other people, and sometimes they've had improvements and sometimes they haven't. And I guess for me, it's kind of good because I can see everything that's happened, all the testing that they've done, and I'm able to have that helicopter view. So I can look at where things go and what connections are there or where there's gaps in information. And sometimes that's why I'm doing functional nutrigenomics with my patients, because they've done oats tests, they've done food intolerance testing, they've done the stool testing. And where the gap is are they actually metabolizing their nutrients properly? Is it a neurotransmitter production or clearance issue, or potentially a detoxification issue?
Mm.
So, and sometimes too, it's you're taking so many things that they're interacting with each other. So, looking at, I have recommended people to get medication reviews from pharmacists before. We sometimes look at the dosing of supplements. You can Sometimes more is not better. It can cause its own issues, but then there's also therapeutic dosing ranges that if you're not hitting the therapeutic dose, you're not going to see the benefits from it either.
Thank you. We also have a question from Dottie. Is there a better option than Combantrin?
Uh, the herbal options are incredibly bitter and they taste terrible, so they're not easy to get into kids. So I usually only go for a herbal option if we think that the worms are resistant to Combantrin. There are a couple of other, I think, retail brands, and there is a supplement called chondroitin that I do sometimes use because it stops adhesion to the gut wall by worms. But I usually start people off with the pharmaceutical ones.
And Dottie's just said, is that triplex?
Off the top of my head, I'm not sure.
Sorry, Dottie, you have to go and research that one a bit more. That's okay.
I
Vicky
will
wants
write it
to,
down though
yes, get back to you
and
later.
have a look.
Vicky wants to know, do you just work with children or adults too?
Look, about 80% of my patients are children, but I do see adults that have gastrointestinal issues. I've got a couple of patients with, ADHD that are adult, or often I end up seeing the family members of my pediatric patients because they go, "Oh, that's what's happening with me too."
What a surprise. What a surprise. Great. Question from Patricia. Does overeating link to anxiety in children?
Well, sometimes anxiety links to overeating, so it depends what, the drivers are. And whether it's cravings driven by potentially gut bacteria, whether it's that dopamine hit, so they're kind of self-soothing by having those often sweet treats. So it's like most things, no one straight answer. Depends on the individual.
Fair enough. Question from Kim. Oh, excuse me. Is there a diagnostic test that could indicate causes of tics?
Uh, Not one test. So things like low iron are linked to ticks. Um, I do sometimes see patients where um, what's going on in their gut can intensify their symptoms. It can be linked to, like I've had one patient, it was post-concussion that they did have tics. So that neuroinflammation is driving their tics. And there is a condition or a syndrome called PANDAS, pediatric acute neuropsychiatric syndrome, where tics is one of the diagnostic criteria, and that they are driven by neuroinflammation in that particular instance. But there's no one test.
Hmm. Okay. Thank you so much. We've only got 3 minutes to go. Lots of thank yous on the chats. I'm loving your engagement today, everyone. Thank you so much. If you've got one final question, we've got a couple of minutes left for Samantha. So I'll look out for that. Otherwise, thank you so much for taking the time out to join us this Natural Medicine Week. This was an amazing presentation. A massive thank you to Samantha, who has just done the most incredible presentation for us all. So we're really blessed. Can't believe this is a free seminar, to be honest. And I love it that you got your cheer squad coming along. And I also just thank you, Samantha, for, just having such a personal sharing there. I think that's it's just been really honest and real and allowed us to really connect with you. So thank you for sharing of your family journey. I think that helps all of us because sometimes you're like, oh my gosh, like Why is it this hard? And does someone else understand? And yes, yes, you certainly understand. And it's complex. And you've really got to. I think I learnt one of those things that you said earlier. If you just talk to your child and say, yeah, that digestive cycle, I thought that was really interesting. And a lot of that anxiety is because of the unknown. They don't know what is wrong, why is it happening? And when you just come back and go, there's a reason we don't like it. But there's
Yeah,
a reason. I thought that was really insightful when you shared that your child went, yeah, it's still there. I just know why it happens. It's like, oh, that's amazing. Also makes you remember why I used to feed my kids early. Gives them a longer time to digest. Uh,
absolutely.
when I had my five kiddies, all grown up now, it's like, yeah, it did help them actually settle when I gave them dinner earlier, which was just an interesting thing. I never linked to that actually.
You
Fran,
don't when you're in the middle of it.
oh, I know. I
That's the
had two.
thing.
I had two sets of twins, 26 months apart, so I certainly didn't think about it. I was just trying to get through the day.
Absolutely.
Absolutely mental. Anyway, we are out of time. Thank you all so much. If you're wanting to recap some of it, it will be on our platforms very, very soon. And I hope to see you again tomorrow. We have a webinar every day for Natural Medicine Week and beyond. We've actually got them every day this month. So much to share with you on the naturalmedicineweek.com.au website. We've also got a whole lot of healthy recipes. We've got blogs from expert practitioners such as Samantha. And also, if you're wanting to find a practitioner, you can jump onto atms.com.au. We've got all of the accredited practitioners from around the country there. And that way you can know that they're all well credentialed and up to date with all of their professional requirements with us. So thanks so much, everybody. I look forward to seeing you again very, very soon.
Thanks, everyone.